today that you're going to require summer visitors to quarantine for 14 days if they come to Rhode Island to visit. Is that correct?
That is not correct. What I said and what is correct is we're thinking about it. I want to figure out how we can enable some tourism. You know, Newport, Westerly, all of Quinnipiac Island, a big percent of our economy is tourism. And so what the Commerce Secretary and I are doing with our community mitigation team is figuring out how do we do that? And one option could be testing tourists. Then the question becomes, can we do that? Do we have the capacity? How do we administer that? So we're looking at it. We're trying to figure it out.
What will be some of your determining factors?
What I just said, you know, how many tests would that require? How would we administer that? Could we work with the Hospitality Association to do that? Obviously, it couldn't be forced. It would be encouraged. So basically what we're trying to do, we're spending a lot of time asking ourselves, how do we safely get people back to work and also help people to feel confident? So frankly, we're having the same discussion about hairdressers. Like, we want hairdressers to be able to get back to work. We also want their customers and clients to feel safe that it's okay to be in close distance to the hairdressers. So would it help if we could test some or all hairdressers? So this is just to give you a view into how we're thinking about it. We want people to feel, yesterday you asked a question, Governor, you can open restaurants, but if people are afraid to go, it's not going to help our economy. So we're just trying to get creative and figure out, can we use testing to give people confidence?
Just to follow up on that, is there a scenario where you potentially would continue the 14-day quarantine throughout the summer for out-of-staters?
I don't think so. I'm hesitating because I don't know. I don't know what July is going to look like. I cannot stand here today in the second week of May and say this is what I think is going to happen in July. However, I can tell you my hope and plan and intention is to be, into phase 3 and relaxing that sort of a travel quarantine. So that's the hope. That's what we're working for. We work for the best and plan for the worst. We're also, this is an area that I'm in good contact with the other governors in this region on. So we are trying to come up with a shared travel policy, and we're not quite there yet, but that's the plan.
Governor, next week the courts will reopen, and eviction proceedings will begin for hundreds of Rhode Islanders. Why don't we have a statewide eviction moratorium like our neighbors?
Just say it one more time, please.
Why don't we have a statewide eviction moratorium like our neighbors,
yeah,
considering courts are reopening and people will start to be evicted?
Getting worried. So I'm working hard on that, figuring out what we can do. I'm worried about it. The courts may or may not reopen. They are still trying to figure that out. I'm working on figuring out more rental assistance, as well as a potential moratorium. We're in close contact with the district court on this. So it's within the next few days, certainly by Monday, I'll have more to say about it.
On rental assistance, we've allocated $1.5 million, and our other states with similar populations have allocated about 30 times that much.
Yeah, no, it's not enough. That was a beginning that we moved quickly. Great credit goes to the Commerce Secretary. He figured out a way to get that done quickly with existing HUD funds, but I agree, we need to do more.
Thank you.
Dr. Alexander-Scott, there's a new study out today, a second study that has shown that these Abbott rapid tests are missing about 1/3 to 1/2 of positive results as compared with the slower, more traditional COVID-19 tests. How can Rhode Islanders be assured that these rapid testing sites like in Lincoln and Central Falls are catching all of the positive cases?
It's exactly what our Rhode Island COVID-19 Testing and Validation Task Force is looking into, so that we can really have an understanding of how it has impacted Rhode Island and how we should be using it to message to the public. We have spoken about the fact that the tests work better when people have symptoms. These studies help reinforce that, particularly if you have people without symptoms who are getting tested. And it's important to also, just going forward, regardless of the type of test, if someone has symptoms and has a negative result, we are saying still stay home if you're ill. Continue to do the same type of isolation that would be required, whether it's the flu or COVID-19 or a cold. So we want to keep working with the public to gain that information. And as we have said, particularly if someone doesn't have symptoms where the test isn't reliable, it is mostly in those situations helpful if it's positive. And then making sure people have the information they need on how to still do what needs to be done if there is a negative result.
Can you pledge to release site-by-site testing data so that we can compare positive rates at the traditional sites and positive rates from the rapid testing sites?
We can work towards something along those lines because we do have the data, and give us some time to work on that.
Thank you.
Governor, you had mentioned
a very substantial need for CNAs in Rhode Island, a huge shortage. We don't know that. But we've been in contact with, I interviewed earlier today, the clinical director of a CNA training program. And she said that they were effectively shut down on their training program on March 30th, and they've been trying to get authorizations to restart their CNA training programs using virtual teaching methods, simulations of clinical practice, whatever was necessary. And she said her standard course is 80 hours classroom, 40 hours clinical practice. And she has 50 students, she said, ready to go in a night program and a day program, but they can't get authorization from the Department of Health, and they've been in communication with everybody from the Department of Health, the nurse licensing board, and so on, but they just can't get anything moving, and they've been trying for, I guess, 6 weeks now. What should she do, and what is your response to that, and what are your recommendations?
I'd ask to get her name from you, if you can give that to Jen, so that we can work on it, because the focus has been to accelerate it. So hearing that type of feedback that shows that we still need to improve on that particular situation, which is hopefully just an exception, is something that we will address immediately.
Are there any impediments to doing virtual training of CNA candidates?
No, no. That has been what we've wanted to happen. Instead of bringing groups of people in to do the training, how can we support it being done virtually so that we can accelerate it currently?
She said she proposed to the Department of Health was having groups of less than or fewer than 5 people. Is that another option that's worth considering?
It's something that we can certainly consider.
Thank you.
Brian LeJean.
Governor, you have mentioned again that Rhode Island is around 3,000 tests a day, but most days, especially lately, it has not been that much.
Yeah.
Is there just not the demand? I know there's the weekend issues and stuff like that. Is there just not the demand for these tests? And what are you seeing, and where can you pinpoint where some of the positive test clusters are coming from? Is it still a lot of healthcare workers?
Yes, really excellent question. So, and something we've been working hard on. We did see maybe the last week or so, we did see a kind of a dip, or at least not an acceleration that we wanted, in referrals coming from physicians. You know, because what we've told people is if you feel sick, call your doctor will get you a test. And we weren't seeing the kind of throughput and volume that we wanted to see from our PCPs. So we have worked very hard on that. Ken Brindamore, who runs testing, along with Dr. Alexander-Scott and the physician groups, to try to make it easier for them to do the ordering and just push the message that we want to increase our testing. So I am hopeful that that will help. I think we've made, just this morning, we had an update call on that, and I think we're going to see progress. In terms of places that we're testing, to be very candid, where we're most focused now in terms of testing is getting into the community. So you have a place like Central Falls. It's the percent positive is high. You know, we want to be below 10%. It is much higher than that. So we are going to have to do more testing in Central Falls. We just bulked up in Woonsocket. Now these testing these places are very low volume. So on a good day, on a walkthrough, you might have 50, 60 people walking through. But our focus is to ramp up, to have more of those low volume, and that just takes time to get the volume. I think you'll see another big wave this summer when we start opening more, and then you're going to see a much bigger wave when school comes back. So we're trying to build a system that's capable of 10,000 in the summer and 15 to 20,000 when the kids come back in the fall.
Governor, if you could provide guidance to some realtors, again, it's kind of a follow-up, but they're getting phone calls from people from out of state that want to rent a beach house in Rhode Island. And one man, Michael, questioned, should he treat all states the same? Should someone from Rhode Island be treated different than Massachusetts? And then what about New Jersey, or if he gets a call from someone from California?
Yeah, so I'm going to answer it, and then I'm going to give Stefan a second. The honest answer is we don't yet have a summer policy. Okay? The honest answer is we're 5 days into phase 1, and that's a phase 2 or 3 activity, and I don't yet have a policy. We're working hard to get a policy. The challenge is it's hard to know in May where you're going to be in June or July. So I just need a little more time to give you better and clearer.
Rhode Island, feel comfortable renting a beach house for the summer?
Of course.
Okay.
Yeah, absolutely.
The additional note I would make is that there is a 7-state consortium now that was formed to dialogue around policies that ought to be regional. And I can tell you there is active dialogue on a weekly basis among all of the states across a broad array of issues. Dr. Alexander-Scott and I participate in that, and there are subgroups that are dialoguing around particular issues. So travel policies and various principles and recommendations pertaining to tourism are a subject of conversation. And just while I'm up here, just a quick note on one of the primary subjects the governor touched upon. Just note on the free supplies, that is the masks and the disinfectant cleaner. Please look to the website starting early next week, starting on Monday, for information on the availability of that.
Could you just touch on campgrounds as well and what those 7 states are? Apparently some people, they have self-contained campers that they don't have to use the public restroom, and they're telling me that the campgrounds are still closed. So could you touch on that?
Sure. I can tell you that that is also a subject that we are discussing among the 7 states, and following this press conference, I'll see whether we can provide additional guidance. But that is likewise a collective conversation, very active as to campgrounds and as to summer camp.
What are those 7 states, if you don't mind either one?
Sure, please. The 7 states, let's see if I can get that from memory. That is Massachusetts, it is Connecticut, Rhode Island, New York, New Jersey, Delaware, Pennsylvania. Is that 7? Accomplished.
And the state capitals.
Thank you.
I do want to say one thing, because I really feel for people who are trying to figure out how to do their business. If there's a lot of Rhode Islanders, maybe you live in Providence and you get the same summer house in Narragansett every year, I think I would feel comfortable booking that. So, I can't tell anyone what to do, but I think it's fair to say if you're used to getting such and such a house, 3rd week of July, go for it. I really want to find a way also for folks from other states to do the same thing, and I have every reason to believe we're going to get there. I just don't, as Stefan just explained, we're trying to have the same policy in the whole region, and we're just not quite there yet. As it relates to campgrounds, Janet Coit, who runs DEM, is working very hard on a plan for campgrounds and beaches, and we're hoping to have an announcement about that probably not until the week after next. Campgrounds and beaches.
Bill and Mark.
Secretary Pryor, I watched your address last night, guidance for restaurants. And I noted that you'd mentioned the earliest that phase 2 might happen is June 1st. So my question again is for me. Pardon?
For restaurants, correct.
For restaurants to go indoors. What's your message to restaurateurs right now about the infrastructure outside of hand sanitizer and masks? For example, they may have to rent a porta-john, or there may be cities that are blocking streets and so on and so forth. Is that really going to be just for 2 weeks of outdoor dining? Do you suspect we'll be back to some sort of indoor dining in a short amount of time where restaurateurs shouldn't necessarily make that investment right now?
A few points. First, it's very important that under the governor's testing the water approach, we attempt to incrementally implement our plans. So it's important that we are successful with outdoor dining, at least in a handful of locations, more, so that we know how we can be effective indoors. So we're very pleased that there are restaurant owners who are gearing up to open up in an outdoor setting. We had a call with the Hospitality Association board today, and I know that there are restaurateurs who are actively gearing up. There are those that are going to take a pass and wait. But why do these couple weeks? And let's keep in mind, it could be longer. I'll come back to that point. Why do they matter? Because we know we can get the systems right for the larger scale implementation of indoors. So we do need to work through a number of issues. The Department of Business Regulation under Director Liz Tanner has been charged by the governor with helping restaurant owners work through municipal issues. So if a restaurant owner wishes to put up a tent, so long as there's adequate ventilation, we don't want to simulate an indoor environment. If they want to put up a tent to protect from the elements, and they need to work through the process with the municipality, we can do that. If there's a closed street and they want to utilize that space to set up for restaurant purposes, we can help you work with the city or town. And I want to also thank Brian Daniels and Mayor Diosa, the executive director and the chair of the League of Cities and Towns. They've been working very closely with us on these policies and approaches. We know that there's a lot of problem solving that needs to occur, but it's very important that we get it right in this first portion of the exercise. The governor has said multiple times, and I said I would come back to this point, the governor has said multiple times, the length of our phases will depend upon the public health data as guided by Dr. Alexander-Scott. So it could be longer that we remain in this phase before we transition to indoor seating. We do hope that more restaurant owners give it a try.
Just follow up as well, a specific point. May patrons use bathrooms inside restaurants?
Yes.
They may?
Yes, that's definitive, and it's in our guidance. The bathroom utilization indoors is allowed. We request and expect more frequent cleanings of the bathrooms than may have routinely occurred in the old normal. We also ask that patrons, the customers of a restaurant, when they're walking to the bathroom or through the establishment in any way, wear a mask. So these things are laid out, and we did a Facebook Live yesterday, and we did a conference call with the Hospitality Association today to get the word out.
Mark?
Governor, I was wondering if you can tell us about any contact you had with your own mother on Mother's Day and how you handled that so that you'd comply with all of the guidelines that you've given about meeting with the elderly in different circumstances like that.
So we called her. The kids and I, my husband, we called her. I have been able to see her. Thankfully, I've been well and she's been well. But, you know, it was a different kind of Mother's Day. We had like a family phone call. And, but I think she appreciated it. She doesn't want to get sick. And she's kind of rolling with it. So.
Where is she right now?
She's mostly at my sister's house. So she lives, we kind of help her, my sister, my brother, and I.
Governor, a conservative group with the help of former state Supreme Court Justice Flanders has kind of put together a legal analysis suggesting that you may have overstepped your authority in some of your restrictions, and I know that's been a criticism on the right, from the right all along. What do you say to those questions over religious gatherings or canceling summer events or making people wear masks, and whether you've overstepped your constitutional authority?
So first let me say, I haven't really wanted to do any of this, you know. As it relates to church, I think I've missed Mass 5 times in my life prior to COVID. So the last thing, like missing church, having to wear a mask, shutting down businesses. For 6 years, I've worked 7 days a week to get our economy going again. So I never viewed any of this really as a choice. I'm the governor. I have a duty to protect the people of Rhode Island and make the tough decisions. Now, I understand it's easy to criticize decisions. I do understand that, and I don't pretend everything I've done is perfect. But I do know that Rhode Island is doing very well relative to many, if not most, other states. And everything I've done has been in consultation with stakeholders in the community, public health experts, Dr. Nicole's staff. So, and everything we've done has been within legal guidance. You know, every executive order has either been allowed to lapse or renewed within 30 days. You know, the state of emergency gets refreshed within every 30 days. So I understand it's difficult. I understand different people don't agree, but I am making the decisions that I think are in the best interest of Rhode Island.